Right?
Okay.
Oh, the Viper slide?
Yeah. Sounds like something you use in a porn movie.
Actually, it's probably better if you
Get out
go
of the
and
Viper
try to do it.
slide.
Okay, so what you're gonna see, she's gonna take that cap off. She's gonna insert the needle there. All right, from this point, go ahead. So if you, from that point, what you want to first turn it on. Okay. If you look at this device here, it starts to go from low to high, low to high. It will stop on low. It's defaulted. Yeah, there's an automatic
It primes itself.
prime, but we still want to prime and make sure that all the air is out the device.
Does it beep at you when it's done?
Actually, if you go ahead and push that.
Green means that pump is on.
Yeah. Right.
See how fast it's flowing now?
I see.
Yeah.
So it goes from
No, I see
17.
it there.
Oh, okay, it goes from like 17 to like 21. There we go. Let's keep on going. All right, as you can see, the signal's coming out here.
25-second beep.
25. All the air is out. You want to make sure that, and all areas, everything's out there.
So
Perfect.
It beeps when it's 25.
So now, if you want, you can turn it off.
Yeah, just let go.
Okay. Now, so what happens is, one thing that we didn't touch on, he did also, when Dave talked about jumping, first thing that you want to do when you get the device out of here, you want to unlock this here, okay? And you want to bring it back, bring it forward, okay? There's different, you know, some doctors say, oh, I like to bring it back all the way to 1 and turn it. Well, some doctors bring it all the way back to the 0 to 1 and lock it from there, okay? Now, regardless of what this may turn, you'll be able to move this a little bit, but it's a little tougher on the locking, all right, once it's locked. Always look at it this way. If there's lines in the road, you can drag on it, right? So it's a lot, it's a lot freer, a lot easier to manipulate. Now, if you're locking it, it's like a roadblock, all right? It's a solid wall right there. You're not getting past, you're not going to get past that wall. So just kind of keep that in your mind when you're in the surgery or in the case. So there we go. So this is this is low. High automatically gets defaulted to low. Okay. This right here is the on and off switch. So let me move this out of the way here.
Single push on, single push off.
Yep. Some doctors you'll see they'll try to hold on to it. They'll try to hold onto the button and it'll automatically turn off after 5 seconds. You want to make sure that they touch it, they unlock it, and then when it's on, you don't want to go over 30 seconds, all right? I try to keep the doctor between 20 to 25 seconds, all right? And it also depends on your lesion, because if you have a long diffuse lesion and you have a very tight, severely calcified lesion, you want to spend time in there, all right? But you want to go slow, okay? So if I were to turn this on, it's on here, it's dripping, we're all set, all right? The first thing that you want to do is cross the lesion. Okay, we have to cross the lesion with whatever wire, whisper wire, whatever wire the workhorse wire that he wants to use. And then after you place that wire, then you want to exchange it for the Viper wire. Okay, so after exchange, that wire should already be there, so have that ready for him. Once he grabs that Viper wire, he's going to send that Viper wire, the back of the Viper wire, through the tip of this device here. Okay, so once that's through, and is that still here?
Yeah.
Once that's through, then we're gonna send that through, and once it touches back here and you see it, you want to call wire, got wire. Okay, so from that point you want to engage the device. Okay, you're going to engage the device, pretty smooth. You're going to wait. The doctor says, okay, I'm good. Keep pulling out. All right, and then you want to get across the lesion. Okay, with our tip, with the crown. I'm slapping everybody with this. All right.
Across.
Yeah.
Across or approximated to?
Right. What's that?
Across the lesion or approximated to?
Proximal to the lesion.
Oh,
Okay, just proximal to the
across.
lesion. Yeah. Okay. So once you're just proximal to the lesion, then you're set. All right. You want to then lock the device. All right. Lock the wire down. All right. If you do not lock this down, this device will not turn on. Okay.
You're still pumping, turn it off.
Yeah. So Any questions so far? No questions? Okay. So once you're at the lesion, everything's in line, you have this locked down, then once you're in position, just proximal lesion, then you want to turn it on, right? You want to test it. I like to test it. Some hospitals, they don't test it, but I like to test it before it goes into the patient, before this crown enters the patient. Test it, make sure it works properly. Once that's in, then you enter to the patient. Proximal lesion, lock it down. Once you get there, and from that point, you can start to spin. Sounds good? Spin on low, right? If a doctor goes over to the high and say, "Oh, I'm going to start with high," say, "Doctor, no, we were taught to go on low. It just decreases the complication. The last thing you want to do is going on high, right off the bat, take a chunk of calcium down and it's going down. You're trying to retrieve that calcium. Okay? So there you go. We're in place. We're getting started. There you go. All right? So as you're engaging, you want to go very slow. So if I'm starting here, this is the speed that you're looking for, okay? And at 30 seconds, you'll start hearing the pitch. You want to listen to the audible pitch. You want to feel it, all right? And the doctor's going to be handling all this, of course, but we'll all listen to the pitch to make sure that we're getting the calcium. And once we're finished, you want to turn it off, all right? That right there, it actually beats 25 to 30 seconds. This will alarm, all right? You need to be pulled back outside of the lesion. You never want to stop within the lesion, all right? You're going to run into a problem, and it will get stuck. So just make sure that you're back out of the lesion, and you want to have adequate rest time. Okay, that's important.
And what's the rest time?
Rest time is equal time. So if you're going through 30 seconds, it's 30 seconds rest time.
Right.
Longer lesions, longer rest time.
Yeah. You want to get that.
Yeah.
You want to get that particular down the system.
Slow flow happened at, I think it's 0.2% in our trial data. Slow flow or no flow. So allowing in the longer segments of lesion, adding more to your rest time is a good practice. Maybe
that's one of the things that we need to emphasize to our docs.
Yeah.
Is to chill after they make a pass.
Yeah. That's important.
And each run to possibly consider vasodilation.
Yep.
More of a capillary bed.
And we want to get back in nicardipine, because nicardipine is the best, especially when you're working on the right corner and you're dropping your pressures and rotoing this, and you've got all kinds of EKG changes. Nicardipine is still the best for coronary. You're not going to drop your pressures with it. It's a great vasodilator.
You also want to take pictures after every shot. Yeah. All right. You want to make sure that everything's a-okay in that vessel. Okay. And for the doctors that that's getting trained up right now and they're out there, we recommend that they stay on low. All right. I mean, you want to be. I'll put it this way: if you're going on high, you need to have exhausted all, the pitches and everything. You want to go 2 or 3 times before you even think about going on medium. But you can do all the work. I mean, on high, but you can do all the work that needs to, be done on low. You just need to take the time. But there are certain lesions. That you want to go high. It's all off vessel size, right? You have a large vessel, then yeah, you can consider going on high. But make sure that they start on the low and exhaust all the options there. All right. And we'll train the doctors on that, but I just want to kind of throw that out to you guys as well.
Excellent.
So the machine beeps every 25.
Every 25 to 30 seconds.
After it's been in the.
That's right.
Okay.
And then
The
you want to.
beep says get the crown to somewhere without disease in it in the vessel,
Let it rest. Okay.
either proximal or distal,
All right.
and turn it off.
That's right.
And allow your rest time to kick in.
Okay. So it's just a reminder.
They're supposed to make sure that they pull the device back when it's still spinning. Yeah,
That's
before
right.
they stop.
Yeah.
Well, I won't.
Can we talk about temp pacing on the right?
Yeah. So I recommend temp pacing on the right. Anytime you're working with the right. I mean, it's a support. You know, it's support. What type of situations have you been in where, you know, you recommended it?
In the right.
Yeah.
Anytime in the right.
Or a
Right.
dominant circ even,
Yeah.
where you got disease in the right. You know, this can affect your waveform.
Yep.
And you can medically manage that, of course.
Okay.
You can add more rest time, do slower runs. Some doctors don't actually put temp pacing in, they just get venous access so that if you do drop pressure on affecting waveform, that at least you have the access, then you get the temp pacing after time and pop it in. So they just have it close to the back table, not open.
It's always a good idea.
It's always good.
Always a
Right
good idea.
coronary, put it on, put it to back up,
Yeah.
set it at 50,
Yep.
set your array at 10.
And if they don't want it,
That way, if it slows down, you don't even have to do anything. It just does it automatically.
Man, when it kicks on, you're just so happy you
Yeah.
got it, and that's that.
But for
So-
pacing,
yeah.
But you get to experience that. You know, I rarely see them either turn on or even, we have a lot of customers that don't use them because they've done a lot of roto and a lot of this. And they're like, look, if it was proximal right, I'll pop one. I'll at least get venous access. But for me, in a mid to distal right lesion, I don't even screw around.
I recommend it every time.
We do as a company recommend it every time.
And if they say no,
So it's a conversation.
have it available, just in case. Because otherwise, you're very short time. Something happens, right? You know, if you don't have it right there, then you're wasting, much needed time.